Welcome to Tenor Tech, where I solve the problems you didn't even know you had.
You begin by preparing both device and skin. Charge the Dr. Pen M8s until the indicator is stable. Once done, attach the cartridge that matches your goal. Smaller needles for fine lines, larger for scarring. Clean the area with alcohol and map treatment zones so you can work methodically. Make sure to remove protective caps and set the device to a low test speed. This avoids surprises. If you use topical anesthesia, wait the recommended time. Then wipe away residue so the microneedles contact skin directly. Now configure the M8s and begin treatment. You select speed based on skin thickness, start low for delicate areas, then position the tip perpendicular and hold skin taut to control depth. Work in a crosshatch pattern, once horizontally, then vertically for uniform coverage. Aim for 4 to 6 passes per zone depending on tolerance. Maintain steady, even pressure so needles penetrate consistently. Pause between zones to assess redness and comfort. Adjust speed or depth if you see pinpoint bleeding or excessive resistance. To finish, gently wipe treated areas, then apply a sterile serum or healing ointment. Avoid retinoids for 24 to 48 hours. Turn off and disinfect the M8, remove the cartridge carefully and store components in a clean case. Replace cartridges after manufacturer-specified uses. If you encounter issues, stop immediately. For excessive bleeding, apply a cold compress and gentle pressure. For prolonged pain or signs of infection, seek professional care. Remember, cleaning and correct cartridge disposal protect you.
Thanks for watching. Subscribe to keep your life in tune.